Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In honor of Breast Cancer Awareness, we discuss the importance of knowing the risk factors, signs and symptoms, and screening of breast cancer. Our goal is always to inform and start conversation.
I have no family history, so I have nothing to worry about, right? Wrong. That's a very big misconception with breast cancer. Only about 5 to 10% of breast cancer cases are hereditary, according to the American Cancer Society.
Wow.
Yep. Only 65.3% of women aged 40 and over had their biennial mammograms in the last 2 years. So we're only just a little over half. So we thought raising awareness regarding these kind of private and uncomfortable procedures will make it easier for women to kind of unite to help kind of move past the thought process of, oh, I don't want to go get my mammogram, to, yes, you do need to go get your mammogram.
There's so many reasons
Yes.
Yeah.
And I think we feel that all women should feel comfortable enough about their health to be able to even bring up these screenings at their doctor's appointments if the doctor doesn't mention it to them.
I agree with that. And I also feel like if you don't feel comfortable enough having that type of conversation with your doctor, then you may look for another one that you do feel comfortable enough to talk about those things with.
I agree.
Did you know that men are also diagnosed with breast cancer as well?
Yes.
People don't realize that men have breast tissue and can develop breast cancer too. So October isn't only about women.
No.
It's about breast cancer, period.
Correct.
So a man's lifetime risk of developing breast cancer is about 1 in 833, according to the American Cancer Society. About 40% of men with breast cancer receive a diagnosis in stage 3 or 4 when the disease has already spread to other parts of their body. And as a result, the overall survival rates are often lower for men than for women. The prognosis for breast cancer in men is similar to that in women, according to the American Cancer Society.
Right.
There's a 96% chance of 5 or more years of a survival rate when cancer affects only the breast tissue at diagnosis. There's an 83% chance of survival when it affects nearby areas as well as the breast. There's a 23% chance of survival if it's spread to other parts of the body.
Right. And the way we're going to kind of tackle this episode is I'm going to be talking more about women. Mm-hmm. And Rosa, you're going to talk more about men.
Yep.
So we can kind of differentiate the differences.
And the similarities.
Right. So for women, different people have different symptoms of breast cancer. Some people do not have any symptoms at all, which is why it's important to get your mammogram. Some warning signs of breast cancer are a new lump in the breast or under the arm, because that's still breast tissue. Mm-hmm. And women, if you've ever been to the gynecologist and they do a breast exam on you, you see they feel all the way over underneath your arm.
Yep.
Thickening or swelling of a part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk and including blood, any change in the size or shape of the breast, and pain in any area of the breast.
For men, the possible symptoms of breast cancer to watch for include a lump, a hard knot, or thickening in the breast, chest, or underarm area. It's usually painless, but it can be tender. There's a change in the size or shape of the breast. There can be dimpling, puckering, or redness of the skin of the breast. It can be itchy, scaly, sore, or a rash on the nipple. Pulling in of the nipple, which is called an introverted nipple, or other parts of the breast, And sometimes breast cancer can spread to the lymph nodes under the underarms or around the collarbone, causing a lump or swelling there, even before the original tumor in the breast is large enough to be felt. So that's why it's really important to do screenings, not just for women, but for men as well.
There's a couple of risk factors that we would like to go over. Well, maybe a little bit more than a couple, but there are some risk factors that we'd like to go over. Females are at higher risk for breast cancer, and age does have a little bit of an effect. Everyone is growing older. If you're alive, you're getting older by the day. And so just like with any other disease with breast cancer, as you get older, your risk goes up. So every day that you're getting older, your risk goes up for breast cancer.
I think that's just for cancer, period. I think we've discussed this in a podcast before, that if you live long enough,
you're going to get something.
Like everybody at some point of time is going to end up with some type of cancer.
Right. The American Cancer Society estimates that about 1 out of 8 invasive breast cancers develop in women younger than age 45.
Wow.
And about 2 out of 3 invasive breast cancers are found in women 55 and older.
And I don't even consider this the older demographic of patients.
No.
When I think of, the elderly, I'm thinking like 70 plus. I'm not in my mind thinking 45 to 55-year-olds.
No, and the older I get, the younger that is.
Wow. Yeah. Male breast cancer is most often diagnosed in men in their 60s or later.
I didn't know that, so that's kind of interesting to me.
I didn't know that either. I learned a lot from this episode that we're doing.
So for a family history, women with close relatives who've been diagnosed with breast cancer are at a higher risk for developing breast cancer. If you've had a first-degree female relative, which is a sister, mother, or daughter, diagnosed with breast cancer, your risk doubles.
And it's the same for men. If your mother had breast cancer, your sister had breast cancer, even your daughter has breast cancer, I mean, your risk is doubled as well.
For a genetic component, like we said earlier, 5 to 10% of cases are heritable. And that goes back to the BRCA1 and the BRCA2 genes that we've kind of...
I think we're familiar about that
Yeah,
now.
I think that was kind of when that kind of came out, that you could be screened for that, and celebrities were going and having...
Yeah, they were having a double mastectomy as preventive measures because their mothers or family members had passed away from breast cancer.
Right, I think that became pretty well known. A personal history of breast cancer increases your risk. It's 3 to 4 times higher for reoccurrence. Radiation to the chest or the face before age 30, which that's pretty rough. If you've had radiation to the chest or the face before age 30, because that means something else is probably going on as well.
Absolutely.
But these could be for like other cancers, and there's actually radiation done for, or excuse me, there used to be radiation done for acne treatment, believe it or not.
I did not know that.
Yeah.
Because breast cancer in men can also be caused by BRCA mutations, men with breast cancer should also get genetic testing.
Diagnosis of another breast condition like ductal hyperplasia, complex fibroadenoma, sclerosing adenosis, papilloma or papillomatosis, or radial scar are all other breast conditions that you would need to be kind of put on high alert for breast cancer.
Yeah, if you have one of these diagnoses in the back of your mind, you should also be thinking about having your regular screenings.
For race and ethnicity, white women are slightly more likely to develop breast cancer than African Americans, Hispanics, or Asians. However, African American women are more likely to develop more aggressive and more advanced stage breast cancers that is diagnosed at a young age.
I have beliefs on this that we consistently talk about. We've never shied probably away from this conversation since we started doing this podcast, but I honestly feel that's because of the disparities in medical care. I can attribute that to lack of insurance, lack of, being comfortable with your provider, lack of education, like a lot of reasons as to why African American women are more likely to develop a more aggressive form of cancer.
I could see it leading to having a more advanced stage of breast cancer. I don't know. I would have to research why it would be a more aggressive type. The type of cancer you have, I don't know that that's been linked to anything that I'm aware of. Now, it being caught in stage 3 instead of stage 1 because...
Yes, and that's what I'm meaning to say.
Oh, the disparities, yeah.
There's a lot of disparities there, in which I think...
for sure.
A lot of ethnicities and races are diagnosed later.
Right. Well, yeah. No, that's for sure an issue.
So... men having a history of testicular diseases or surgeries, having inflammation of their testicles or surgery to remove a testicle can actually have an increased risk of having male breast cancer. I guess it makes sense.
Hormonal.
Yeah, it makes sense.
Weight does play a factor with breast cancer. So if you were overweight or obese as a woman, you have a higher risk of being diagnosed with breast cancer compared to women who maintain a healthy weight. And this is especially true for after menopause. And being overweight can increase the risk of breast cancer coming back to women who have had the disease prior. So keeping a healthy weight is good for many things.
It's harder for women after menopause because those hormones that helped regulate your weight are no longer being produced.
Mm-hmm.
But the case is, men have to worry about their weight as well. Obesity is associated with higher levels of estrogen in the body, and that increases the risk of male breast cancer.
And that makes sense.
It does.
So for pregnancy, women who have not had a full-term pregnancy or have their first child after age 30 have a higher risk of breast cancer compared to women who gave birth before age 30. I just found that to be interesting.
It is too.
And breastfeeding can actually lower your risk for breast cancer, and especially so if you breastfeed for more than a year. So another reason why breastfeeding is a good idea.
Men who have been exposed to estrogen, like estrogen-related drugs, such as those used for hormone therapy for prostate cancer, it increases their risk of breast cancer as well.
For women who started having their periods younger than age 12, have a higher risk for cancer later in life. The same is true for women who go through menopause when they're older than 55.
Wow.
So if you get your period young or menopause later, you're at risk. Using hormone replacement therapy can cause higher risk of being diagnosed with breast cancer. Since 2002, when research linked the hormone replacement therapy and the risk, the number of women taking that has dropped dramatically. So that association has been recognized. It was recognized in 2002. And so practice has, the doctors have changed their practice because of that. Of course, that's not something that men have to deal with directly.
This is their one break in this situation.
Right. So alcohol, this was, I don't know, a little frustrating for me. And I'm not a drinker, but I was like, really? So research has consistently shown that drinking alcohol, beer, wine, liquor increases a woman's risk for what is called hormone receptor positive breast cancer. And alcohol can increase levels of estrogen and other hormones associated with that breast cancer. Alcohol increases cancer risk by damaging DNA cells. So compared to women who don't drink at all, women who have 3 drinks per week have a 15% higher risk of breast cancer. That's a big jump for 3 drinks a week.
That is
in
not
my opinion.
Even a lot. That's, to me, that's not even a lot of drinking.
No. And experts also state that the risk of breast cancer goes up another 10% for each additional drink women have regularly
It's crazy because every time you turn around, there's a study that kind of contraindicates itself.
Yes.
They'll say, oh, a glass of wine a day, there's nothing wrong with that. It actually increases your lifespan, antioxidants, blase, blase. And then you turn around and then another study says what this is saying, that, you know, you have a 10% increase, you know, if you're having a drink every day.
Absolutely. I'm like, okay, I don't drink regularly at all. It's social, even at best.
Mm-hmm.
So this doesn't personally affect me, but I just think about the people that I know who will go out on a Friday or Saturday, hang out with their friends, have a couple of beers, and that's putting them at high risk. And then if they do anything else
On top, yeah.
on top of that, it goes up. It's
Like if you're not eating healthy, look, you've just increased it because now
You're overweight.
You're drinking, maybe you're smoking. So now it's like a triple effect.
absolutely.
So I can totally get that. For men, when you drink, it kind of exposes you to liver disease and certain conditions such as cirrhosis of the liver. And that can reduce male hormones and increase female hormones, which increases a man's risk of developing breast cancer.
Dense breast tissue, it also makes you twice as likely to develop cancer versus women who do not have dense breast tissue. And if you're a woman who has dense breast tissue, you usually know that because you have to go for a mammogram and then you have to turn around and go for an ultrasound, and everything's always fine, but it's that same back and forth kind of game.
That's nerve-wracking, I can imagine.
Yeah, we have a lady that we work with that has to do that every year or every other year, and it still puts her on edge because it's, well, what if it's actually something this time? Mm-hmm. Exercising regularly does help lower your risk of breast cancer. I believe exercising regularly helps lower your risk of all cancers.
I think exercising regularly helps everything.
It really does. And by regularly, it's 4 to 7 hours per week to, lower your risk.
That's an hour a day if you break it down, right?
Well, if you do the 4 hours a week, it's even less than that. I'm all about, like, how can I...
35 minutes?
Yeah.
I'm down.
Yes, absolutely.
I say I'm down.
I'm not really.
Yeah.
I saw something on social media, and I've been telling everybody since. I'm like, no, that it explained me perfectly. I said I'm allergic to exercise. I break out in a rash. I get really red. I get sweaty. I get really short of breath. I start having muscle cramps.
Those
I'm allergic.
sound like serious allergic reactions.
Exactly. I'm allergic to exercise.
Oh, me too. I'm working on it, though. I'm working on it.
Yeah, I'm taking baby steps. Smoking. This should go without saying. Smoking increases your risk for everything that I think we've ever talked about. So just quit if you smoke, because it increases your risk for
everything.
Breast cancer. And there's actually also been a link between people who have been exposed to very heavy secondhand smoke that actually increases risk for breast cancer, specifically postmenopausal women.
I know we work in a pulmonary office.
We do.
And I believe I've heard a few times before that secondhand smoke exposure is actually worse than firsthand.
I just feel like if you have to have a cigarette, do it where it's not going to affect anybody else besides
just
yourself.
Go outside, man. Go outside.
Pretty simple.
I hope that stick keeps you warm in the winter, because you're not smoking in my house. For men, Klinefelter syndrome is a genetic syndrome that occurs when boys are born with more than one copy of the X chromosome, and it causes abnormal development of the testicles. As a result, men with this syndrome produce lower levels of certain male hormones, androgens, and more female hormones, estrogens, which we know can increase their risk of breast cancer.
I think that kind of wraps up all of the different risk factors that people have. So now that you know your risk factors and just kind of going down through the list, you might be like, oh, wow, I hit 3 or 4 out of those categories. So it kind of gives you a little ability to check yourself.
Yeah, it's a gauge,
It is. But knowing your risk factors isn't really going to do much for you if you don't get your screening.
I agree.
Knowing when you should be screened is pretty important. I'm not there yet, so it's something that's kind of in the back burner of my head. But patients should be performing self-breast exams 5 to 10 days after onset of menstruation. That is something that you're told every year by your GYN, or at least I am. It's a pop quiz every time we go. Women aged 50 to 74 should get mammograms every other year for screening. Women from 40 to 49 should talk to their providers about their risk factors and see if they need to do earlier screenings. For example, if you've had that radiation when you were younger for acne, if you have your sister or your mother had breast cancer, or you do have the BRCA mutation, you may want to start your screening a little bit earlier.
For men, doctors should be asking about symptoms and your personal and family medical history, and that's including history of estrogen use or radiation treatment. They will also carry out a physical exam. They may suggest, the following tests, such as a mammogram, an ultrasound, a nipple discharge test, and even a biopsy. And most insurance companies will cover cancer screenings at 100%. So please check with your insurance company to see if your breast cancer screening would be free.
Absolutely. I've been in nursing for 11 years, and I've met one male patient to have breast cancer. And it was actually an incidental finding because somebody was being thorough.
It happens.
It happens. And
it happens.
He was young. That probably changed the whole course of his life. Well, I'm sure it did change the whole course of his life, but if that would have been overlooked, then
the conversation would be much different.
Absolutely. It is out there, and I think it's just important that we don't exclude it from our thought process. I mean, 1 in 833 men is pretty common then.
And it is currently overlooked. That's why they're diagnosed later when they're in stage 3 and 4, because there's not enough awareness being brought to the forefront about men having the ability of having breast cancer.
Right.
It makes sense mentally if you're a nurse, because men do have breast tissue.
Yeah.
But there are a lot of misconceptions even regarding men. We hear this all the time. Men don't even want to be checked for prostate cancer and go to their annual visits.
Right.
And now you're telling them they have to check their breasts too? Can you imagine?
Yeah.
And so we need to find a way for them not to be so, stigmatized, and, the guys, clowning on them, for lack of a better word. Get your exams. It shouldn't be embarrassing.
It's a battle. I mean, I didn't have to fight this year for a flu shot, so I'm calling it a win for 2020. I'm just saying.
You're packing it up.
I'm done. Yep, I'm good.
I don't know. I have my mammogram coming up next month, so we'll see how it goes. It's my first one.
Yeah, see, I always joke that I'd see it if I had something wrong.
You're
so
silly.
Evidently, they say that's not true. It's not going to work. It's not a good guideline, not a good screening tool. But if we as nurses do what we're supposed to do, we just are going to continue to educate our patients, because that is, I feel like, something that we do from day one, is educate our patients. If you're a nurse, you at some point have been asked by your family or your friends for some kind of advice. I have never met a nurse that hasn't.
I don't even want to talk about the photos that friends take and send to you.
Yes. You know that your friends and your family are talking to you already regularly, whether you ask for it or not. Sometimes I'm like, do I have that face that says talk to me? I really don't try to. Like,
you're warm and fuzzy. We've had this conversation before.
I am not warm and fuzzy. I am kind and considerate, but warm and fuzzy is usually not adjectives to describe me. Although I did get called a sweetheart the other day.
See, you're not a cactus.
Because we have these open conversations with our family and our friends that are female or even male, because here I go, leaving them out, we have the ability to empower them with knowledge of what they should be doing.
Absolutely. I agree with that.
So the next time you talk to your mom
or your dad
or your brother,
especially
if they have risk factors for men, to say, hey, just so you know, you could have, breast cancer too. You should do your screenings.
As always, we will link our references in our show notes on our website at www.thenursingpostpodcast.com. We would love for you to join our conversations and leave comments and suggestions there too. Be sure to subscribe to our podcast while you're on our website, and you can listen to us on your favorite platform and follow us on social media. Thanks again for listening to the Nursing Post podcast.